Hi, my name is Chloe, and this is my insertion of a Foley catheter. I am in course BSN 206, section 13. So for this video, I am going to be removing my badge just because we need to maintain sterility. And then I'm also going to be rolling up my sleeves to maintain that as well, okay? So for this video, my supplies are my 2 washcloths, a pair of clean gloves, my disposable bag, my work area, and my sterile field for the insertion of a Foley catheter, okay? So the first part of what you would do is you would go ahead and knock on the door, go into the patient's room, introduce yourself. Hi, my name is Chloe. I'm gonna be your nurse today. Go ahead and perform hand hygiene. Ask the patient to please verify their name and date of birth for verification policy, and also explain the procedure to them, okay? So, hi, my name is Chloe. I'm gonna be your nurse today, and we are gonna be inserting a Foley catheter. Are you okay with that? Okay, so for the first step is I'm gonna go ahead and put on my pair of clean gloves since I already did hand hygiene. And I would ask the patient to get into the position of lying on their back with their knees bent and legs falling outward. We're also going to make sure that the curtain is closed for privacy. So with my washcloth, I'm going to go ahead and spread open like that with my fingers, and then we're going to wash this side. Using a different part of the washcloth, I'm now going to do the other side closest to me. And straight down with the other side. Okay, then I'm going to go ahead and dispose of that. Then I'm going to use this washcloth to just pat dry. Okay. During this time, we're also going to inspect. We want to look out for any discoloration, any odor that we may be smelling, anything that stands up that's going to need further care, any masses, any lesions. Everything looks good though. Okay, so now I'm going to go ahead and remove my gloves and dispose of them. And I would then perform hand hygiene again. Next, we're going to get out our sterile insertion of a Foley catheter package. Go ahead and place that over there. Okay. So once I open this, we're in sterile field. So you want to make sure that we don't break that at all, okay? So pulling away from us first with the 2 sides. And then this is how we're going to end, by pulling towards us. Okay, just like that. So first we're going to go ahead and put on our sterile gloves. Okay. We're going to go ahead and use this outer surface right there. Just like that, making sure that this lip is still pulled over, okay? Then we're going to go ahead and put on our left hand, making sure to keep our thumb away so that we don't break the sterile field. Just like that. And keeping that folded as well. Okay, so now we're going to go ahead and dispose of this by pinching the inner side, and we're going to dispose of it, okay? Next, I'm going to go ahead and drape this under the patient's butt. All right, Miss Smith, we're going to go ahead and drape this under your butt, making sure to keep your legs towards this side, and just like that, okay? And we're going to drape this one as well. So now this is all of our sterile field right here. So we don't want to break that at all, okay? So now that we've done that, I'm gonna go ahead and organize my workspace a little bit. Okay, I'm gonna go ahead and open the alcohol swabs first. I'm gonna place them right here, okay? We're gonna dispose of this. Then I'm also going to, I would then put the lubricant right on this side right here. And now I'm gonna get the catheter. We're gonna remove this. Excuse me. And we would then lubricate it. Okay, I'm just gonna let it sit right there, okay? Then I'm gonna get my sterile water and go ahead and remove the cap. And I'm going to attach it to our tubing. Just like that. So next we're gonna go ahead and clean. So I'm gonna place my hands right here. And we're gonna start with the outer side farthest away from me. Dispose of that. Then the side closest, dispose of that. And straight down, just like that. Okay, now I'm gonna make sure I keep my hands here without removing them. I'm going to grab my catheter. And I'm gonna be holding it 2 to 3 inches from the tip. Okay, I'm going to go ahead and insert. And once I start to see urine, I'm gonna go ahead and advance it 2 more inches. Okay, so we're gonna go and advance it now. Okay, so now I'm gonna go ahead and let go right here and just hold it secure while I inflate the balloon. We want to make sure that we insert all of this. Okay, now that I've inserted it all, I'm going to remove my hands here so that I can take this off. Because if we don't, it's just going to fill back up and the balloon won't be fully deflated. So next, I'm going to tug on the catheter a little bit until I feel resistance. Once I do, I'm going to stop. Okay. Now I'm going to go ahead and remove the drapes. Just by tearing. So we're going to go ahead and remove that, as well as this. And I'm going to use this just to clean the peri area. Okay. Take out all of my tubing. And we would then dispose of this. Okay. Next, I would make sure that this is clamped, and we would also I'm sorry, I would remove my gloves first and dispose of them. Perform hand hygiene, and then I would make sure that this is clamped. I would attach it to the patient's leg and make sure that the bag is lowered on the patient's side of the bed. Something like that. Okay. Once we're done, we can make sure that the patient is comfortable. And if we wanted to, we could also cover the area with a towel or washcloth for the patient's comfortability. Okay. After that, I would then document my care, perform hand hygiene, and that is it. Thank you.